Welcome to our Bright Notes Technology webinar. My name is Vicki Humphreys, and I'm with Software 2 Systems. Today, we will focus on the partnering of EMR with transcription, ways to adopt EMR with minimal workflow disruption, and discuss final ruling of meaningful use and how we can help with interoperability to hospitals, laboratories, radiology, etc., resulting in a successful EMR implementation. There are unique differences in today's EMR programs. Currently, McKesson is one of only 4 companies offering a technology known as discrete reportable transcription, or also known as discrete reportable data. This BrightNote technology allows doctors to practice medicine without changing their current charting style and automatically synchronizing data across the entire patient chart. Research has shown that the template-based charting style may actually distract from the important cognitive workflow of providing patient care, which limits analysis and thoughtful review. View clinical data without giving up the narrative dictation style. Although there are 4 different charting styles, speech recognition, templates, keyboard, and transcription, today's focus is on utilizing transcription and how to capture and view clinical data without giving up the narrative dictation style. Here is an example of a dictated note that has been transcribed using the technology of dot codes. Notice the codes at the beginning of each line representing elements of the patient's clinical electronic chart. This particular example shows how the file looks in the background and automatically interface into the EMR program. Examining further into the progress note, notice the continuation of the dot codes preparing your dictation for distribution into a progress report and moving each element into the appropriate area of the clinical chart. Notice the .K family history and .K social history. These elements will automatically be moved into the corresponding areas of your patient chart. This feature gives you the flexibility to have quick access in review of patient care, comply with meaningful use requirements, and report on historical data. To summarize, transcribed output is directly entered as discrete recordable data. Physicians continue the way they currently practice in medicine. Electronic charts are automatically created. Doctors and staff now have access to electronic clinical notes, improved and integrated clinical documentation, coding, and outcomes. As shown in this example, unlike many other EMRs of its kind, this technology creates what is referred to as a single-note synchronization through a single-screen entry point. Single-screen charting makes it easy for physicians to complete the note using their preferred input method. With one touch, data is instantly synchronized to appropriate folders within the chart. Searchable patient data is automatically generated to help quickly produce meaningful clinical care reporting. So why, after over 2 decades, is EMR adoption lower than expected? Studies show the top 2 reasons that EMR adoption and implementation is no further along are cost and disruption of the practice. While we believe that McKesson's product solution is well within the price structure of a 1 to 10 physician office, disruption of the practice workflow has been a little more difficult to overcome. However, with discrete data technology, this can be accomplished. Whether we agree with the stimulus effort or not, $19 billion has been set aside to accelerate the use of EHR. Medicare provisions are including incentives up to $44,000 per physician over a 5-year period, or providers can choose the Medicaid provision, which includes incentives up to over $63,000 per physician over a 6-year period. On July 28, 2010, the Department of Health and Human Services published the final rules for meaningful use and certification standards in the Federal Register. The final meaningful use rule reflects real-world perspective and changes requested in the industry. The 2 required final rule categories for meaningful use are Category 1, core. The 15 core objectives are not optional. Specified measurement for each objective must be achieved. Category 2, menu. The menu set of objectives allows the eligible providers to select 5 of 10 objectives based on their current stage of EHR implementation. There is now a reduction in many of the achievement levels. Administration and financial objectives, which are electronic claims submission and eligibility checking, have been deferred to stage 2. 2 points regarding the relaxed final ruling requirements are 30% of patients' clinical orders versus the previous proposal of 80% must have one medication order entered via computerized patient order entry. 40% of all permissible prescriptions for electronic prescribing written by physicians, down from the previously required 75%, must be electronically transmitted. Coming soon, Software to Systems will present a final ruling analysis webinar. This webinar will summarize the 864-page final ruling and point out the facts. We will explain the major advantages of getting started in 2010 through 2011. We will discuss in Stage 1, relaxed requirements for physicians, Stage 2, improved clinical processes, Stage 3, how phased-in date has been delayed as to be determined. What are the benefits to the provider when adopting EMR? Practice efficiency, implementation with minimal disruption, meaningful use requirements are met.